81. Good. Hello everyone, this is Dr. Khan, another Facebook Live. This is a very interesting case. This is a nice lady, as you will see, 100% total capsulectomy. In this case, it's the intracapsular, and this is residual capsulectomy 5. My bad, today is the 15th, correct? Yes. So I'm going to change this to 15. 15, 5/15, 2025. Initials KD. And so this is a lady who had, in 1998, saline implants. Then in 2019, she opted to get silicone implants, 550 cc's. Then she got very sick and ill, what are suggestive of breast implant, unless she according to her, like deathly ill. And so in March of 2025, just a couple months ago, she ended up getting the Explant. And that Explant, it was noted that this silicone implant on the right side was indeed ruptured, and her surgeon left the capsule behind. And so she improved, but not back to normal. And so she came to me for what is residual capsule removal, having had her surgery done just a couple months ago. And she had the many symptoms of what is breast implant illness. And we'll certainly hear from her. She's very much wanting to do, and I appreciate her coming forth, and she will do a Facebook Live with us. So the task was to remove the residual capsule. This was above the muscle, and I checked below the muscle, there was no residual capsule. And the task was to remove the residual capsule, number one, and number two, there was spilled silicone on the right side because the right implant had indeed ruptured. So as soon as I went in, within this pocket right here, this is where the implant was sitting, and as you can see, this is like that sac, if you will. And so this entire very thick capsular tissue was indeed very much removed, and in it I found remnants of what is silicone, ruptured silicone, and I have a video of that as soon as I entered. So all of this was contained, and as you will see, this was that inflamed. It has a brown orange tinge to it. This capsular tissue was removed, relatively very thick, and it was left behind. So residual capsulectomy was performed, and all of this hard scar tissue was removed along with this inflamed tissue on the side. I did remove some of the skin for contouring purposes. You can see the skin right here. And so all of this inflamed tissue on the periphery was removed. And as I entered into the sac, there was this fluid that was noted. So what I have done here is, as you can see, this is relatively thick and viscous. It has a milky tint. I'm going to send this off to pathology, just like we know. This is consistent with very likely a seroma, because she did not wear any pressure garments, and this fluid will be going, just to be complete. Anytime there is any fluid around the breast implant capsule or anything, it has to go to pathology to rule out that rare BIALCL cytology. CD30 analysis is done, and we'll send this fluid off almost 13 cc's. So as you can see, look at the consistency. This was left behind, and she was in a very definitive way wanting to get this off, and I'm glad she did, because we don't want this to be in her body. This is not healthy tissue. Now we will hear from her and see what symptomatic improvement she's had. We'll see what the pathologist says. And we're going to post her video as soon as I entered what we found. Now I have a new set of gloves, sterile. I found what is more serous fluid. It's more fruit punch colored, if you will. It's not milky. And so this is going to go separately from the left, what is intracapsular fluid, what is consistent with a seroma. And so this is the left residual capsule and inflamed tissue. Now this was relatively calcified, and the surgeon did attempt to remove some according to the patient. But here we go again, capsule relatively very thick. The other thing I want to highlight is there was suture that I removed. And there was a ring of, like a rim of sutures that I removed, like right here, 1, 2, 3, that essentially closed this pocket, if you will. You see all of these foreign material was removed. What I'm going to do is I'm going to cut right through this. Very hard, as you can see. And you can see this is the inside area. And look at this calcification. I want to open this up here. Let's see what this is. Look at this. We have seen this yesterday as well. It's like a pasty brown. I'm going to go ahead and incorporate this so that the pathologist can look at it. Anything bad, palpated bad, looked bad, felt bad. My gut said it was bad. It was removed, such that only good, healthy, viable tissue remained behind. And as you will see, this is that brown mud type of a consistency, and all of this inflamed tissue was removed. So residual capsules will be sent to pathology along with liquid, i.e. the fluid that was found intracapsular within this, that will be sent to cytology separately for CD30 analysis, both the capsule and the liquid. And then only good, healthy, viable tissue remains behind. The bad inflamed tissue all has been removed, as you see. Cultures will be done for bacteria, aerobic, anaerobic, and fungal. And most importantly, we'll see how the patient does and recovers from her signs and symptoms, what are strongly suggested, or what is first and foremost, and their reactivity to the silicone. This is Dr. Khan, Executive Plastic Surgery.